Hello, my name is Abigayle Campbell, and my research project is on the impact of pharmacist-led education on medical resident knowledge of diabetes mellitus management. Myself and my colleagues who worked on this project have nothing to disclose. To understand this study, we need to first look at how pharmacists can provide education, both formally as professors within schools and as preceptors on rotations. Informally, pharmacists can provide education while on the job within a patient clinical scenario to various types of colleagues and professionals. Additionally, pharmacists can play a large role in the education of diabetes management, as the therapeutic options can often be complex and specific in nature. A study conducted in 2019 assessed primary care providers and internal medicine providers on their knowledge of type 2 diabetes therapies and found that almost one-fourth to one-half could not identify major trials related to cardiovascular events or major medications that pose an increased risk of adverse events. Additionally, there have been studies to assess incorporation of diabetes education to medical residents. In this pre-post design study, knowledge was assessed using a survey and found that statistically significant differences exist when implementing online case-based Q&A simulations on the medical resident knowledge in diabetes therapy management. Our purpose was to see if pharmacist education can impact medical residents' knowledge of diabetes therapy management. This study was conducted at Greenville Memorial Medical Campus Internal Medicine Clinic, which is an expansion site of the health system's ADA-accredited diabetes self-management education program. The study was completed over the course of 5 months at a single center and was designed as a prospective pre-post study with a proportion of secondary outcomes assessed retrospectively. Providers received education using our internal diabetes algorithms for insulin and non-insulin agents. Study participants took the same pre-test and post-test to assess their knowledge of diabetes treatments and use of the algorithms. We also asked the participants to self-assess their confidence in diabetes management utilizing a Likert scale. To be consistent with the various types of education pharmacists can provide, we identified our interventions as formal and informal education to medical residents. A pharmacist led 4 in-services once weekly to the medical residents on Monday mornings at 8 a.m. for the topics listed here. As a part of this education, participants were also given a handout to keep and take with them related to the material. Informally, pharmacists within the clinic were able to provide direct education related to specific patient clinical situations as they arose on a day-to-day basis. Our primary outcome was to assess the change in post-assessment score from baseline assessment score, while the secondary outcomes analyzed were the change in pre-post survey provider confidence, as well as the usage of appropriate medication selection based on concomitant disease states. Data analysis was completed with the help of our statistician. Demographic information of the residents who completed both the pre and post are listed here, with a total number of being 6. Of note, there was a fairly equal distribution of participants by program year, those being 1, 2, or 3, as well as the number of in-services attended. It was not required that they attend all 4. 5 out of the 6 providers had not completed a previous endocrine rotation. It was found that for the change in baseline assessment to post-assessment score for participants, there was an 18.5% increase. Listed, you can see the average baseline to post score. 4 out of the 5 did have increased scores, with 1 out of the 5 remaining the same. For the percent change in confidence from baseline, there was an increase of 25%. All 5 of those providers had increases in their level of confidence in diabetes management. Within the retrospective patient review, we were able to obtain information related to the patients who were seen by the interdisciplinary team in the clinic, which resulted in 23 total patients during the time frame of our study. Based on the 2019 ADA guidelines, our goal was to assess if appropriate diabetes therapies were initiated for patients with concomitant diseases. Less than one half of patients at baseline were on appropriate therapy. For patients with known ASCVD, one patient was appropriately initiated on guideline-directed therapy by adding on a GLP-1, while two patients were appropriately taken off of SGLT2 inhibitor medications with known CKD based on specific patient characteristics and adverse events. It is important to keep in mind the short time frame of the study in relation to the number of opportunities to see the patient to make these changes. Our study is not without limitations. First, a statistical analysis could not be performed due to the small sample size. The study also utilized non-validated assessments and confidence scales, and there was difficulty in obtaining post-assessment results from the providers. Since the study's completion, the health system has expanded our pharmacist-run clinic into the family medicine resident clinic. If this study was to be completed in the future, trialing different in-service times may potentially yield increased participation, as well as prospectively looking at patients' outcomes who attended the pharmacist-run clinic. A special thanks to those who helped conduct the study. With that is our self-assessment. Our presentation objective is to define the role of pharmacists as educators on medical residents' knowledge of diabetes. The self-assessment question is which of the following is or are techniques that pharmacists can utilize to provide education to medical residents? A, case-based Q&A, B, direct instruction, C, provide informational handouts, D, use of in-service discussions, or E, all of the above. The correct answer is E, all of the above. I would like to thank you for listening to my presentation on the impact of pharmacist-led education on medical resident knowledge of diabetes mellitus management.